The 4 square metre rule and the 1.5 metre distancing between students during classroom activities is not appropriate and not required. I can't be more clear than that.
A clear instruction for sure, but one that might be confusing for parents and teachers. Our Chief Medical Officer says the science backs it up.
We are not seeing evidence of significant transmission amongst children in schools, and the data is increasing in this space. We think the community risk of having children together in a classroom is low.
When school returns properly is still up to the states and territories. The government insists it'll be safe for students, though teachers will have to take care.
Clearly, school can be a risk for adult-to-adult transmission, from parent to teacher, teacher to teacher, and we have made a range of recommendations of keeping vulnerable teachers out of the school environment.
If you had to lift restrictions at the moment, schools would be top of the list. It is safe for kids to mix without social distancing. However, teachers should observe social distancing between each other.
Show us the evidence and explain to us how it is that the decision makers around these issues have now come to the view that social distancing in a week is no longer essential in our schools.
So should back to school mean back to normal distances for students?
Well, Dr. Norman Swan is the host of ABC's CoronaCast podcast. Norman, thanks for joining us. Now, when I think of school students, I feel like hygiene isn't exactly high on their list of priorities. I mean, let's face it, kids can be gross. Is this really the right move?
Well, I think there's an element of pragmatism here. I think if we were earlier on in the pandemic, and I had a fairly hard line on schools, the school age group probably contribute 2 to 4% of the deaths from COVID-19 if they were free ranging in the community. They probably contribute about 10% to the spread of the virus. I mean, that's controversial, but so it's not nothing, but it's not huge. The really big age group is the 20 to 29-year group for spreading the virus. So the pragmatic thing at the moment is that there's not much COVID-19 around at the moment. So by the time schools go back, particularly in New South Wales, we're probably going to be down to very few cases being spread in the community. In that environment, it's a risk. You're playing risk here. The risk is low in the classroom, but kids do spread it. It's just that they don't spread it a lot, and they could spread it to teachers. But the risk seems to be higher in teachers because the symptomatic disease is higher. There's probably a relationship between whether you're symptomatic and how infectious you are, and kids are less likely to be symptomatic. So it's risky, but not that risky, particularly when we get to mid-May, and hopefully if we've all the rest of us have obeyed the rules, we should be down to almost no cases in Australia.
I get that we're being told that the medical advice is that children spreading it to other children is unlikely, so the risk is low. But why then is the risk apparently high of children spreading it to older people? And that's why they're being told to stay away from their grandparents, for example. You and I, Peter, have been on about this since the beginning. There are contradictions in the messaging to the public. And that's what makes people confused. So several weeks ago, when the Prime Minister was heading for the football and we had the Grand Prix occurring with 240,000 people, people were being told at that point to socially distance themselves, and people couldn't actually work out the two, and they didn't make much sense. So there is an issue here. Why I'm not going nuts about this is that it's not going to happen today. It's in most, in Victoria, the kids aren't going back. In New South Wales, they'll go back in mid-May, and by that time we should be down to very low levels and the risk is low. But my view, which is the implication of your question, is that there's a lot of COVID-19 around. There is a risk in schools, and it does confuse people by saying, well, are there double standards here? Maybe we should relax, because the message here cannot be at this point in time, relax the lockdown, because we haven't got down to a level where we're really sure there isn't a background spread of the virus in the community.
Dr. Norman Swan, we'll have to leave it there. Thanks so much for your time.
You're welcome.